Hi everyone, I'm Dr. Robinson with Synergy Chiropractic Center. I am a licensed pharmacist and a certified functional medicine practitioner. Now, let me start by answering the question that I get almost every day, and that is, what is functional medicine? It's just root cause medicine. Basically, it's supporting the body so that it can heal itself, and only using medications and surgeries as the very last resort. Most chronic diseases at their core result from a combination of all the same things: poor diet, not getting enough sleep, not exercising, stress that's out of control, and sluggish detoxification pathways. So these are the things that we focus on. If you want to feel better and see results in your health, this is where you need to start. In today's video, I will be discussing endometriosis. Now, this is a somewhat common issue for women, but the how and the why of endo are still very much undefined. With endometriosis, tissue that normally lines the uterus grows in abnormal locations in the pelvic cavity. Now, these areas of tissue that grow are called implants or lesions, and they are most commonly found on the ovaries, but they have also been found in other places like on the bladder, the colon, and other ligaments in the pelvic cavity. Now, these lesions may or may not cause symptoms, but if they do cause symptoms, these could include ongoing lower back pain, lower abdominal pain, pain when using the restroom or pain during intercourse, painful periods. They can also cause very irregular or heavy bleeding. And if the lesions are on the digestive tract, it can cause diarrhea, constipation, and other things like bloating and nausea. Women also can get very fatigued. They can also have pain with exercise and even groin pain. Now, if all this weren't enough, infertility is also a very common issue for women that have endometriosis. Conventional medicine treatments for this include medications for the pain, like anti-inflammatories, so like Motrin or naproxen, and surgery to remove the lesions. Now, in functional medicine, we go to the source of the problem. Now, these amazing bodies of ours were made to be so resilient, and we believe if we just give them the proper tools, more times than not, our body can do the rest. Our body can improve on its own. Now, when we're looking at endo from a functional medicine perspective, the goal is all about decreasing inflammation. So no matter if you are undiagnosed or you've already had surgery and you've been diagnosed, whatever the course of your endo or suspected endo, these strategies that I'm going to talk about are things that you can implement today that can help you start feeling better. Now, I have never had the diagnostic surgery for endo myself, but I have a very strong suspicion that this is something that I deal with. My symptoms match up pretty close, so I started putting some of these things into practice, and I have noticed a huge difference with one thing in particular, and I'll talk about that in just a minute. Let's start with nutrition. If you've seen any of my other videos, it all starts with nutrition. Always, always, always. And it makes sense that we would start there, that we would start with what we put inside our body several times a day. It makes sense that our food could have a profound effect on us. Hippocrates said, "Let food be thy medicine." So that is the name of the game here. So let's talk details. What should you eat? Well, this might be slightly different depending on your age, your body type, your health goals, and if you have any underlying chronic conditions. But the research points to a low carb, Mediterranean diet being the best for overall health. Now, in my opinion, for a woman struggling with what is suspected or confirmed endometriosis, the best option to follow closely for at least 6 to 12 months or until symptoms improve is this diet. Now, the Mediterranean diet is just like how it sounds. It's inspired by the eating habits of people from that area of the world. Now, their diet is rich in fruits and vegetables. They have a lot of olive oil, legumes, nuts, and whole grains, which those are minimally processed, and they have locally grown produce as much as possible. Now, the main source of healthy fat in the Mediterranean diet is olive oil. Cheese and yogurt are eaten in low to moderate amounts every day. Fish and poultry are eaten in low to moderate amounts a few times a week. Now, this is different. Red meat is consumed very infrequently and in small amounts. And if they have desserts, they usually have something like fresh fruit with honey, and they will only have that a few times a week. If these changes seem overwhelming to you, let's just talk about where to start in terms of getting your plate to look more Mediterranean. Now, you can replace margarine or butter with extra virgin olive oil or avocado oil if you're cooking with high heat. You can eat nuts instead of processed snacks. They're easy to just pack and take with you if you're on the go. You can add a wider variety of fruits and vegetables to your plate. That can go a long way. You can replace sugary drinks like soda and iced coffee with juice or water, and eat less red meat. And I will tell you that made such a huge difference for me. I avoided red meat almost completely for 4 weeks, and it was, I'm not kidding you, it was the most manageable period I have ever had. And seriously though, I am not exaggerating. At first, I wasn't convinced that this made the difference, but the next month I went back to eating meat and everything was back to how it had been before. So I cut out the meat again with the same amazing result. And it was clear to me that red meat increases inflammation in my body. So I can't necessarily say that it'll be the same for you because everybody's different, but it could help. Now, other things that you should avoid, and these are kind of basic for everyone across the board, no matter what health issues you're dealing with. You want to avoid processed food, sugar, and alcohol. Now, I'm definitely not saying that you can never have these things, but what I am saying is that we know, okay, we know these are the biggest offenders when it comes to compromising gut health. And remember, our gut is the first line barrier to what gets into our body, and it's the powerhouse for our immune system. So it makes sense that if we are really suffering from a chronic condition, including endometriosis, that giving our gut the support it needs is where we can see the biggest impact and overall improvements. Another thing that can help is exercise. Now, we know exercise is important for digestion and for detox, for relaxing us and reducing pain, and it even boosts our immune system. So in relation to endometriosis, it can help with gut function, which we discussed is very important in endo. It flushes out toxins, including excess estrogen, which is thought to be a contributor to inflammation, especially with endo. Exercise can relax us, which is important because stress is always a factor in every chronic disease. Now, the key here, though, is not to overdo it because that can increase inflammation too. So just listen to your body. If you're feeling overly exerted or lightheaded, or you have pain besides just normal muscle soreness, you're probably overdoing it. So light to moderate exercise is best for now until you can get your symptoms under control. And next I just have to mention sleep, because this is foundational to our health. Now, I heard this old Irish proverb the other day about sleep, and it's just so good, so I had to share. So it goes, a good laugh and a long sleep are the best cures in the doctor's book. And I just love that. So when it comes to sleep, you'll want to get between 7 and 9 hours of sleep each night. And you'll want to include the window of 10 p.m. to 2 a.m. in your nightly sleep. In a normal circadian rhythm, this is when our body repairs itself. Now, I know that there are people who claim to function well on just 4 to 5 hours, but for the most of us, it's just not enough for our body to repair and reset for the next day. So remember, try to get between 7 and 9 hours every single night. Next, I want to talk about sitz baths. Now, I haven't tried this yet, but this technique can be especially helpful for women that are struggling with endometriosis and that are trying to get pregnant. Now, it does incorporate essential oils into the bath. So how you want to do this is make a mixture in bulk and then just use 9 drops for each bath. Now, the ingredients are 4 drops of geranium essential oil, 20 drops of rose essential oil, 8 drops of cypress, 40 drops of nutmeg, and 32 drops of clary sage. Now, there are several ways to do a sitz bath, but the easiest way just has 4 steps. So you want to run a hot bath and add 9 drops of your essential oil mixture into the bath and just kind of stir it around. And then in another bathtub, or like a small baby tub, you'll want to fill that one with cold water and 10 milliliters of rose water. First, you want to relax in the hot bath for 15 minutes and then sit in the cold bath for 5 minutes. And you'll want to do this every single day. Now, essential oil massage can be good. I've actually had some pain relief from it. And I won't really go into the details of that because it's a little bit more complicated than what I can go into in this video. And it also requires some basic knowledge of the use of essential oils. So if you feel confident in that area and you want to know about essential oils, it is a treatment avenue that you will probably want to pursue. And for more specific information on how to do an essential oil massage, you can check out a book called the Endometriosis Natural Treatment Program. And this book has the most detailed and easy to understand explanation of how to do this specifically for endometriosis. And it wouldn't be complete without mentioning stress management. Now, we all know that stress management is important for overall health, but I think the hang-up is that, well, several. Number one, we don't realize we're under stress, or we think we should be able to handle it. And number two, we don't put the time and effort into actually relaxing. So first off, we need to recognize that we're under stress, even if we don't feel like it. Our jobs, our families, groceries, cleaning, laundry, kids' activities, family gatherings, paying bills, planning vacations. These are all occasions for stress. And with the rapid progression of technology the last 100 years, expectations of us are higher than ever. So recognize that we are all under stress and our bodies can't always handle it. Now, when it comes to relaxing, it is not always just sitting on the couch doing nothing. In fact, that may create more stress depending on what you're watching. So I recommend some other forms of relaxation, like anything that's out in nature. Dancing, anything artsy. If you're artsy, I'm not, but that could be very therapeutic for you. Praying, reading, or meditation is huge for many people, and prayer is one of my personal favorites for relaxing. And don't forget to spend time with some girlfriends. being around other women, sharing our struggles, laughing and enjoying time together, it is such a crucial part on our path to wellness. So I've given you several things that could be helpful for you if you have really any chronic condition, but especially endometriosis. The physical and emotional pain of endometriosis can be very deep, but I hope and pray that you or someone you know can get relief by making some of these practices part of your routine. Thank you so much for watching and have a fantastic day.